When you look at some of the encouraging vaccine news, how quickly will we get to herd immunity in the US if every approval goes to plan and we start vaccinating fairly soon?
Well, the vaccine data that we're seeing so far look very promising. The latest is the AstraZeneca data. Now, their data is a little bit challenging to interpret given the press release that we have, because we know they had a different study design and a different vector than the other two so far. But with those promising data, I think we're looking to see vaccine uptake be really the focus as we move towards distribution, and the states are already working on a plan. And with that, I think we could start to see a much safer place for being out and about and reducing some of those restrictions by late spring, early summer of next year.
Lauren, December is critical, so it's Thanksgiving over the next couple of days. How worried are you that people actually, want to see family and friends, rightly so, but don't take the right precautions? And so 6 weeks from now, we'll be hit by a second to third wave.
Yeah, I think we're all very worried about that. As we look at the data of what's already happening across the U.S. in particular, given that it's the Thanksgiving holiday coming up, followed by the other winter holidays, we're all focused on what we can do to reduce transmission, what we can do to put measures in place that allow people to be protected. We are already seeing massive upticks in cases. Hospitals are already straining across the country, much more so even than in spring when it was localized to very specific regions. So we can't pull resources from another place to support these upticks. And travel is still high. We're seeing airline data showing that people are definitely still traveling. People are coming home, kids are coming home from colleges, kids are coming home from, primary and grade schools. And so there's going to be new mixing in these populations that we haven't seen otherwise. So we are expecting the cases to definitely tick up, and we're hoping that people are as careful as possible when they make their holiday choices. The CDC is discouraging large gatherings. Even these moderate-sized gatherings can have a significant impact on spread of the disease.
Lauren, what do we understand about the vaccine? When we have the vaccine, are we still a conduit of passing on disease to someone else, or is that link broken?
So it depends on the vaccine. It depends on what the vaccine data show and what the vaccine was designed to do. We have vaccines that show reduced transmission, particularly in asymptomatic and pre-symptomatic spread, like the latest data from AstraZeneca. Now we'll have to dig into that a little more when they release their peer-reviewed results and their protocol, which will be super important. And then we see that reduction in symptoms and the burden of disease in some of those earlier vaccines. Ideally, we want to see that reduced transmission, particularly in the asymptomatic and the pre-symptomatic spread. Some of the more recent data shows that as an important driver of this pandemic. And so the focus on understanding what's happening in those people, for example, the AstraZeneca study did look at cases in their asymptomatic population. So people who didn't seem to have any disease or any symptoms, they're testing them to understand whether or not transmission has been reduced, and cases in those asymptomatic people are there.